It is an honor to welcome someone who understands not only the scale and complexity of the problem, but is able to clearly articulate the immense opportunity in front of us. Please join me in welcoming Dr. John Kitzhaber.
Well, thank you. Thank you for that kind introduction. I'm actually pretty excited to be here. Some of you may know I started my career as an emergency room doctor and also my political career just north of here in Roseburg. So coming back to Southern Oregon always feels like coming home, and I really appreciate your invitation. This wasn't what I was going to talk about, but the story that we just saw really moved me. And I remember when I started practicing in the ER, I was 27 years old. I was 4 months out of my internship, and I was terrified. The people were probably terrified as well to have a 27-year-old guy looking over them. What I remember most is how vulnerable the people were who came to see me. They didn't know me. They were hurt. They were afraid. They were looking for help, and they put their trust in me and sometimes their lives in my hands. And it was an enormous responsibility. And I remember once an elderly woman came in, and she had chest pain and shortness of breath, and so I worked her up for a cardiac problem and didn't find anything, sent her home. She comes back the next time I'm on, and when I was charting, we used to actually do charts in those days, she was coming in quite a bit, and she only came in when I was on. And so I told the receptionist, I said, next time she shows up, don't check her in unless she looks like she's dying, and just come and get me. So I took her down to the cafeteria, and we had a cup of coffee and had a talk. And she had a brown bag of medication. She was seeing a cardiologist for atrial fibrillation. She was seeing a rheumatologist for arthritis. She was seeing a urologist for polycystic kidney disease. And she was being viewed and kicked around the system as a kidney, a joint, and a heart. She didn't need access to medical care. She needed access to compassion. She needed access to someone who could make her feel belonging and part of something. She needed someone to talk to her about the maze and help her guide through this and to deal with her pending mortality. She needed access, but it wasn't access to medical care. And I also remember during the recession of the early 1980s, I saw a young woman come into my unemployment. Well, you remember that time, unemployment was about 22%. And she looked like she'd run into something. She had this black bruise with a laceration on it. It wasn't a very serious laceration. I sewed it up and took her down to the cafeteria again, one of my favorite places for, hospital didn't like that very much. And it turned out she'd been hit by her husband, who had worked at Sunsuds as his father had and lost his job. And after 6 months, he got sullen and depressed and started drinking and then became abusive and then violent. And I remember seeing more and more people like that come in during that period of time. And it was the human face of poverty. It was the human face when hardworking, proud people can't put food on the table. And I've never forgot that moment. And Alice needed access to medical care. Her husband needed access to a job. They needed access to the security of knowing they could pay for their house and their rent and look after their kids. So I want to talk about access today in sort of a broader sense. Access to medical care is really important, but I want to start. I can figure out how to use the technology up here by looking at your